There's a pre-assessment form which we send out to all people to fill out, which gives us a bit of their previous medical history. From there, we make sure there's no contraindications through their consultant, and then I'll do a process of assessment by myself, which will consist of doing range of movement, as well as measuring their leg length. So you'll look at from the floor to the malleolus, the joint line just below the humeral condyle, into the trochanter, and then once you've got those measurements, it's just a case of adjusting the REX, which takes about 5 minutes, and then they can get in for a transfer. So with the transfer, we've had people full hoist into the device, or some people actually transfer independently. The main part of it is sitting the REX down. You can open the legs up for easier access, and then you just transfer the user in, do all the straps, and then you're ready to go. Big lean forwards, and we'll go for a stand. That's it, lovely. Good man, perfect. The beauty of REX really is that it's inherently stable, so it actually enables the user to have complete control over their rehab session, which is beautiful. For me as well, because it reduces the manual handling I have to do, increases my efficiency and improves the quality of treatment all in all. The user will just control the device through the joystick. They have control when they step, when they move left and right. They can also do range of movement.
The benefits from walking in and using a REX, well, I imagine I get my spasms can be quite bad in my legs, so I think through using one of these and through getting a range of movements in them, and through putting my body weight through my legs as well, that helps the spasms and helps calm my legs down. And also I know that well, it'll help my range of movement in my legs. It'll help me regain some suppleness in my legs and in my movements. It'll be good for my joints, and also standing up and being able to move around and stuff. It's like your circulation and like your digestive system and everything that flows kind of downwards. It helps rather than by sitting down, like the blood and things would tend to pull, but by standing up you get a better blood flow, and you feel healthier for doing it, I think.
Another beauty of REX is that it's completely adjustable to the user, so you can actually swap the bars over, replace it with a T-bar. Again, enabling high-level users. We've had up to C4, but that's not the limit to get into REX and move around independently, which is amazing for them, but also reduces the strain on me.
Getting used to walking, it didn't take me as long as I was expecting it to. It was, it came quite naturally. I felt. I mean, once I learnt the parameters of the movement, once I learnt how far I'd walk and how quickly I'd walk, once I became comfortable with those, it felt quite natural just to be able to to push the joystick and to take the steps forwards, backwards, side to side where you need to go.
So there's no limitation to the actual pathology as to who can use REX, but I've personally had people with MS, stroke and Parkinson's and a lot of spinal cord injury using it. The actual other limitations with regards to the parameters of REX are things like having good baseline skin integrity. You have to be between, as a guide, 4'6" and 6'4", but it's actually down to limb length, which is the main thing. We developed a whole load of exercises for the lower limb and upper limb called REXercises. They enable the user to do robotic assisted range of movement and strength conditioning all the core muscle groups, both upper limb and lower limb. When I was doing the exercise, when I was stretching things, I could feel like my legs were spasming. They were quite tight, and I was having a few shakes on my knees and things, and I could tell that the stretch, I know when I'm getting a good stretch if my legs do that, because that's where I'm tight. So if I can go past that point and the spasm will happen and then break through the spasm, then it's a good stretch. And my legs were never that. My legs have never been that loose really. So because I get quite tight, because they do get quite tight and they are prone to shake sometimes when I'm getting stretched, it definitely helps. When a hospital receives a REX, they'll receive a whole lot of training and package of support. That will last from anything between 3 days to a week, depending on their needs and the amount of users they actually have within the hospital. So we offer training to the physios, so their patients can use the REX, and we will train them to the point where they can train other physios and other healthcare assistants to help people use a REX. On a personal level, REX has enabled me to reach to a much greater demographic of users. It's enabled my quality of treatment to improve as well as my efficiency, and I really do think this is the future of physiotherapy.